Alright, so now we're gonna do Goni for knee extension and flexion. So the fulcrum is gonna be lined up with the lateral epicondyle of the knee. The stationary arm is gonna be lined up to the lateral midline of the femur using the greater choke as the reference point. The moving arm is gonna be lined up with the lateral midline of the fibula using the fibular head and the lateral malleolus as reference. So you're going to bring the patient through first. So it should be about 135 degrees, and he has 130 degrees of flexion. And for extension, it's going to be the same. You would put a pillow or a towel. The landmarks are the same. It'll be 10 degrees of hyperextension. He has 10 degrees. For knee flexion MMT, you'll have the patient laying prone. And then you can start them at about 45 degrees of flexion and then have them bring their leg up towards their bottom. And then back. Then you apply resistance for 4 and 5. And then to test the semimembranosus and tendinosis, you would invert their foot medially and ask them to hold it there. And for the biceps femoris, you would have them bring the foot laterally and then have them hold it there. That's for 3, 4, and 5. For grade 2, you would have them sideline. You support their leg and ask them to bend their leg. That's for flexion. And then for grade 1, you would palpate about the back of the hamstrings for a trace. For extension, you would have them laying down supine. Sit up. Yeah. And you have them straighten out their leg. For grade 3, for grade 4 and 5, you would straighten out their leg and then unlock it. And then have them hold their leg there. Don't let me push down. 4 is mod, 5 is max resistance. And then for grade 2, you will have them sideline. Hold their leg up, bend their knee, and then just have them straighten out their leg. For grade 2, and then for grade 1, you will feel just above the patella with the tendon of the quads. Alright, so now we're going to do Goni for dorsi and plantar flexion. The landmarks, the fulcrum is going to be on the lateral malleolus. The stationary arm is going to be lined up with the lateral aspect of the fibula using the fibular head as reference, and the moving arm is going to be lined up with parallel to the lateral aspect of the 5th metatarsal. It's a firm end range, and for dorsiflexion it is 25 degrees, and for plantar flexion is 50 degrees. There he got 30. And there he got 35. And for inversion and eversion, it's gonna be a firm end feel for inversion and a hard for eversion. The landmarks, the fulcrum is going to be in between the two malleoli. The stationary arm is going to be lined up with the tibia. The moving arm is going to be lined up with the second metatarsal. The inversion range of motion is 35 and eversion is 15. So there I got 40 for inversion, and for eversion I got 16. And now for rear foot, you're going to have the patient laying down prone. The landmarks for this, the fulcrum is going to be lined up with in between the two malleoli. The stationary arm is going to be lined up with the lateral, the posterior aspect of the foot, and the moving arm is going to be in the midline of the calcaneus. For eversion, there is no AAOS measurement, and for inversion it is 5 degrees. So there I got 5, and then there I got 6.